I'm going to analyze another scene from the Pitt, and this one has an infectious disease component to it because it's part of what we would call the differential diagnosis of what a doctor does, what a provider does to try and determine what are the causes of whatever symptom or sign that they're seeing and which are most likely. You kind of make a list. It's what's on the differential, is how we often say it. So let's see what they've got.
Where was med school?
UC Irvine.
California, right?
Yep, Pittsburgh's a little different.
Yeah, a lot more humidity.
Yeah, that'll go away with your first foot of snow.
Hi, Mrs. Davis. I am Dr. McKay. This is Dr. Tumarian.
The first thing you see with this patient is she's yellow. What does that mean? The medical term is jaundice. And jaundice occurs when there's a buildup of a specific protein in the blood called bilirubin. And there's several reasons why that might occur. Bilirubin is in your red blood cells. If your red blood cells are bursting, that could increase your bilirubin. But one of the more important causes, and that's going to become relevant in a second, or one of the more common causes, I would say, than hemolysis, is liver disease, because your liver will help you excrete that bilirubin into your urine. It's one of the reasons why your urine is yellow. And if your liver is not functioning well, that bilirubin will increase and you start to see jaundice. You may see it in your skin, you may see it in the whites of your eyes, and that tells you that there's a buildup of bilirubin. It doesn't tell you what's causing it yet, and that's what we're going to see them go through.
Hello. Your labs show a lot of inflammation in your liver.
So I am so nauseated.
Definitely, yeah. Have you noticed a change in your skin coloration?
I've been using this bronzing cream.
Now, you've heard them say that there is evidence of liver inflammation on her blood work. So that's liver function tests, or things like AST, ALT. Those are elevated, and she's nauseated, which is often a common symptom with liver inflammation. So now they've got to figure out, why is her liver inflamed to the degree that she's had jaundice?
So I don't look like a ghost in my bathing suit.
Do you remember the name of the bronzer? It could have a chemical that can cause it.
No, it's 100% natural. It's DHA from sugar beets. Why would my liver be inflamed?
There's a lot of possibilities. Are you taking a
Now you hear them talking about the fact that she may be taking a natural bronzer and there might be toxins there that could increase her liver enzymes. The key thing that's happening now is that they're trying to understand what's making her sick. And they're going to go through a bunch of question and answers with her. And each of them has a reason, because they're trying to hone in on, why is this woman's liver inflamed?
any prescription medications?
Not a single one.
Tylenol?
God, no.
We have to ask everybody about injection drug use.
Never.
Raw clams or oysters?
So they're asking her a bunch of things, and a couple things are important from an infectious disease perspective. They're asking her about injection drug use. Why? Hepatitis C, hepatitis B, hepatitis A, all liver viruses that can be spread through injection drug use. So that's why they're asking that. Now they're asking her about seafood. There are certain infections like hepatitis A that can come from seafood as well. Remember that, like clams and oysters, those are filter feeders. So whatever sewage that they're swimming in or they're living in, they can suck that in and you can get infections that way. So they're trying to go down a list, which includes some infectious causes and some non-infectious causes, like Tylenol, for example.
I'm a vegan. One step at a time. We'll be back. He asked me to see a patient with a night intern.
He said yes.
48-year-old woman, new onset jaundice, elevated liver enzymes, no history of alcohol use.
Take your pick. Hepatitis A, B, C, D, or E.
No risk factors, no fever.
Tylenol?
Never, no prescription meds.
Does she eat polar bear liver? It can cause vitamin A toxicity.
No,
Yeah.
she doesn't eat meat, kind of a health nut.
Well, maybe she's gulping down cod liver oil to prevent measles.
Vegan, no fish. Would you mind laying eyes on her?
Seriously.
You have a way of figuring out the weird stuff.
Take the compliment.
Okay, fine. 5 minutes at the bedside, that's it. We're already gonna be here for hours as it is.
Thank you.
What am I doing?
No congestion, nodules, or cirrhosis.
Good-looking liver.
They're doing a bedside ultrasound looking at the architecture of the liver, and they're not seeing any major abnormalities. They're not seeing evidence of cirrhosis, which is a sort of an end-stage fibrosing condition that can occur. They don't see any nodules, which are basically kind of growths there. It looks good on the ultrasound.
I should not be sick. I worked so hard to stay healthy. Diet, exercise, 8 hours of sleep.
I can't remember the last time I got 8 hours.
Maybe you should try sleep maxing.
Oh, you definitely should.
Yeah, cold room, white noise, eye shades.
Kiwis before bedtime, lettuce, water, mouth taping.
Who do you follow for health?
A few naturopaths and some functional healers.
Earlier, you heard Dr. Santos rattle off a whole bunch of letters: hepatitis A, B, C, D, or E. That's what you have to think about from an infectious disease standpoint when someone has jaundice. And these viruses are very common in the world. We have vaccines for hepatitis A and B. We have a cure for hepatitis C. Hepatitis E, we're getting to a vaccine and it's starting to be used in certain parts of the world. But these are important causes to think about. So hepatitis A and E are transmitted very similarly, fecal oral. So certain types of food substances can spread those viruses. And hepatitis A can also spread through injection drug use as well. Hepatitis B and C, usually injection drug use as well. If you're finding it in adult, hepatitis B is also sexually transmitted. Hepatitis C is mostly bloodborne. And we basically have to kind of narrow that down by looking for different blood tests, looking for results that might indicate one of those viral hepatitises is present. In this case, it's not, but it is a non-infectious cause. It's from a toxin, from a natural product. However, this is something that is really important to go through when you're seeing a symptom that could be caused by have an infectious cause and could have a non-infectious cause.
Do you buy vitamins from them?
Oh, no. I don't take vitamins. Food is the best medicine. Kale, blueberries, kidney beans, turmeric.
Turmeric?
How long have you been taking that?
For a few months. It's an anti-inflammatory. It detoxes the body and it can prevent Alzheimer's.
How much do you take?
500 milligram capsules, but I take 5 a day. What?
With doses that large of turmeric, there have been cases of liver failure.
From eating a spice?